For those of you just joining us, welcome and thank you for attending the session titled Investment to Protect, NCDs as an Investment Priority to Boost Society's Resilience and Recovery, co-hosted by the NCD Alliance, the World Health Organization, and the World Diabetes Foundation. I will now pass the floor to Ms. Kathy Dane, CEO of the NCD Alliance. Ms. Dane, the floor is yours.
Good afternoon. My name is Katie Dane, CEO of the NCD Alliance. And on behalf of the co-hosts, the NCD Alliance, the World Health Organization and the World Diabetes Foundation, thank you for joining this high-level event entitled Invest to Protect, NCDs as an Investment Priority to Boost Society's Resilience and Recovery. This event is taking place midway through our Global Week for Action on NCDs campaign, which began on Monday, the 5th of September, and focuses on the theme of NCD investment. This is our 5th Global Week for Action campaign, which serves as a unifying and rallying platform for the global NCD movement to call upon governments, other institutions to step up and to take bold action on NCDs. The choice of NCD investment and financing as the theme for this year's Global Week for Action campaign needs a little explanation to this audience. Financing remains one of the Achilles heels of the NCD response. Although there have been a multitude of political commitments made by governments on NCD financing over the years, these are yet to really translate into adequate and sustainable financing for this global health and development tsunami. Very few have put their money where their mouth is, leaving a funding gap larger than any other health issue. And at what cost? NCDs will cause more suffering and lives lost this decade than any other health issue. They'll drain the global economy and impede human capital. And they'll undermine any effort to ensure the world is better prepared for future pandemics after COVID-19. Yet we have the evidence that the return on investment for governments are high and compelling, along with the solutions, the tools and the know-how to change the trajectory. So against this backdrop, today's virtual event will bring focus to this urgent need for investment in NCDs within the context of pandemic preparedness. We will reflect on the challenges, the opportunities, and good practice for mobilizing sustainable and smart financing for NCDs, particularly in low and middle income countries. We will also explore the opportunity of a second WHO Global NCD Financing Dialogue planned for 2023, with perspectives on what success would look like and a roadmap for getting there. So with that, let me hand over the floor to our moderator, Mr. Bent Lautrup Nielsen, Head of Global Development and Advocacy at the World Diabetes Foundation, who will steer us through the remainder of the event. Over to you, Bent.
Thank you very much, Katie. And on behalf of the World Diabetes Foundation, it is a great pleasure and honor to moderate today's event under the title Invest to Protect, NCDs as an Investment Priority to Boost Society's Resilience and Recovery. This event happens in the Global Week for Action on NCDs campaign of the NCD Alliance, and I think we should congratulate the NCD Alliance with a very strong and powerful campaign so far. We are moving towards the 2025 fourth high-level meeting on NCDs. But we know that without radically accelerated, expanded investment into NCD prevention and control worldwide, we cannot meet the targets set in the WHO Global Action Plan, in the SDGs, and also in our aspiration to achieve universal health coverage by 2030. The situation has not been made easier with the COVID-19 pandemic, which we have seen and shown us the vulnerability of people living with NCDs and health systems. But the question is, which investments and how, which are the resources, and how do we mobilize them. Obviously, there will be financial resources, there will be technical, there will be political and systemic and socio-cultural. They are in different formats because the NCD response is complex. There will also be domestic and international interaction as we move along. We already discussed this at the first global NCD dialogue on financing, which happened here in Denmark, where we are based with the WDF in 2018. And I believe we have seen progress since then. And we know that we have an opportunity moving ahead. The return of investment for individuals, households, and communities is clear, and for the wider health and development for societies worldwide. But what we need to discuss much more and to understand better is to see which models have worked, which partnership coalitions could be scaled up, and which commitments have actually, since 2018, turned into real change on the ground. So that we, with the next year's second global dialogue on NCD financing, will be able to accelerate even more. So I hope that we together, over the next 90 minutes, can sharpen our thinking even a bit more. And I could think of no better way to kick off the event than with a statement from WHO's Director General, Dr. Tedros. Could we please have the video recorded statement on? Thank you.
Every year, 17 million people under the age of 70 die of non-communicable diseases. Most live in low and middle income countries. Most of these deaths are preventable, treatable, and manageable. Nearly 7 million lives could be saved by 2030 if low and lower middle income countries invested an additional $1 per person per year on cost-effective interventions like graphic warnings on cigarette packaging, food labeling, and bicycle lanes. The potential benefits are huge, not just for health, but for sustainable growth and development. WHO calls on all countries to invest to protect their people and their economies from NCDs.
I believe we should all thank Dr. Tedros for his commitment to the NCD agenda. And again, we see the clarity of the challenge before us. We have today a very strong and diverse panel. We have representatives from governments of Norway, Tanzania, and Uruguay. We have representation from civil society and national level stakeholders from Ghana, Mexico, and India. And we have representation from international agencies, RTI, Bloomberg Philanthropies, the Africa Center for HIV/AIDS Management, and the IFC. Before we start the sessions, we have another very important statement, which is from Michael Bloomberg, the WHO Global Ambassador for NCDs. Could we have the video statement on, please?
Hello, everyone. Every year, 41 million people die from a non-communicable disease, making it the leading cause of death worldwide. And the tragic toll it takes on families and communities is compounded by the economic toll it takes on nations. Yet NCDs remain one of the most underfunded global health issues. The good news is you know how to prevent many of these deaths. And by working together to spread prevention and management policies and practices, we can save lives. and strengthen local economies. A report issued by the Task Force on Fiscal Policies for Health, which Larry Summers and I chaired, showed that if all countries significantly raised taxes on tobacco, alcohol, and sugary beverages, we could prevent over 50 million premature deaths over the next 50 years. Plus, the taxes would raise more than $20 trillion in revenue to support public health programs, helping to save even more lives. We've made some progress, but not enough. This forum is a great opportunity to accelerate it. So thank you for all of your hard work. It really is making a very big difference, and all the best.
Once again, a very notable remark and statement from Michael Bloomberg, and I guess we all know the importance of the commitment of Michael Bloomberg and the NCD prevention and control movement for many years. I'm sure we will hear more about some of his remarks later on when we have the intervention from Bloomberg Philanthropies. There will now be a short poll because we would like to know a little bit more about the audience, all of you who are joining us today. And I'm sure the technical facilitator will guide you. There's a question now online, and it's actually one question only. What sector do you work in? And you can please select accordingly. And I think we can move on with the outcome of the poll is here online now. And I think we can see a quite balanced representation today, which is, I think in itself is encouraging, since there will be no sustainable NCD response without a multi-sectoral and multi-stakeholder engagement and partnership. And I guess it also is a good way of moving on to our first panel, which is a very decisive part of the NCD response, the government perspective. And we have a very strong panel with us today. And we will start with the first speaker, and it's Mr. Paul Fife, who is the director for the Department of Human Development of the NORAD from the Norwegian government. Paul, thank you so much for joining us, and I'll give the word to you.
Thank you, Bent. Pleasure being here. Since the last global NCD financing dialogue in 2018 and the UN high-level meeting on the NCDs, Norway has indeed stepped up its NCD financing through integration of NCD action into health system capacities and enhanced public health action in relevant sectors. So this includes a dedicated development program to combat NCDs. Let me in this respect highlight the work of international partners such as the NCD Alliance and also WHO. WHO is a key partner given its normative stewardship function and is a trusted policy and technical advisor to national health authorities. So we believe NCD prevention and control is something we as development partners cannot ignore in our efforts to reach the SDGs. We think it is important to be clear on advocacy messages for increased NCD financing, as this has implications for priorities for action. First, concerning that 1 to 2% of official aid is directed towards NCDs, we do agree that aid for health in general is not sufficient. But we do believe that a proper way to finance NCD action is in general through health system reform more broadly, as opposed to very focused disease control program approaches, such as we have seen for some infectious diseases. Also, to put it squarely, just campaigning for great allocation of aid resources away from one program and two NCDs is not the way to go, at least not from our side. So I also want to be constructive here. We need more resources for NCDs. But I just want to highlight that we need to be careful to not give the impression that donors and donor financing are the most instrumental in driving or not driving investments in NCDs. Demand increasingly comes from populations in low and middle income countries. We also see this, I think, in the poll in this webinar. And those countries are facing a serious disease burden transition. Also, for all but the poorest countries and countries in conflict or humanitarian crises, the investments made by governments, insurance agencies, private companies also, and the degree to which they are universal, meaning equitable, are far more important than donor aid. Aid can be catalytic and flexible when done right, and sometimes it is the most dependable resource, but on its own, we know that aid is not enough. So what we see as a challenge for many countries, middle-income countries and low-income countries, that we not only need to build systems that deliver on a subset of effective RMNCH and disease control interventions, but systems that are able to address the increased health risks faced by aging populations. This includes public health functions, promotion and prevention, as well as service delivery. So the big challenge is actually to build a broader, more equitable and efficient health system, and integrating NCDs into this system is the path forward. I spent some time basically to lay out this position, but because we think it has implications on the success we as a global community and as donors also will see in the years to come to respond to the challenges. Let me raise three issues we think are important as we together move forward. The first one I already alluded to is that to achieve with the progressive realization of universal health coverage, this requires health systems capacity to provide quality service and financial risk protection without financial hardship. We think that partner countries need to manage a much more complex health system as we move forward, and that we need to think through what kind of alignment and technical support we could offer as an international community to build such capacities. As to financing, health systems in low resource settings are increasingly turning to national health insurance schemes as a means to finance UHC and promote equity. Many of these services are built around reimbursing service providers for clinical services. NCDs must be part of these benefit packages. Given that a major challenge is that such packages usually are not able to finance promotion and prevention risk factors, this is an area we need to further look into to ensure efficient use of resources in very stretched budgets. So my last point here, Bent, would be that we know that government health spending in low-income countries has been too low. I'll be very frank about this, and heavily relied on external donor resources and, unfortunately, quite large out-of-pocket payments. This has resulted in a highly fragmented health sector with planning and budgeting largely at program level. As major funding sources and very influential in priority setting, global health initiatives and their donors, as well as large bilateral donors, we need to strengthen collaboration and, in concert with partner countries, align our support at country level to reduce fragmentation, facilitate health system development, and integration of a wider range of services, which includes NCDs. And we also need to manage AIDS transition. We see this as the major imperative for health donors beyond the 1 to 2% allocation. So more money, but also a new way of working. Another imperative and a common challenge to us all is to work on climate change, sustainable food systems, pollution, and health. We know that creating healthy environments for reducing NCDs has many health and non-health co-benefits. Investing in NCDs now is an investment in a better future. the future of people, health security, and economic stability. So thank you, and back to you, Bent.
Thank you so much, Paul. And I really wanted to take a few notes here, highlight a few of your remarks, especially your emphasis on national health insurance schemes, the way the universal health coverage thinking is gradually, obviously slowly, but still moving in that direction, because we see a diversity of mechanisms worldwide. And how do we bring that configuration on? I believe that's one of our big questions, hopefully also in future settings of conversation. I should though say that since the 2018 conference, if there's one progress that I have noted, it would be the Norwegian strategy released in 2020, where you, I think, as one of the first countries in your Better Health, Better Life strategy, really took a leading role here. And I think we should all be very thankful to that. But we will get back to you, Paul, in the Q&A. I think now we should introduce our next speaker. It's Dr. Omari Ubuguyu, who is the Director for Curative Services at the Ministry of Health in Tanzania. Do we have Dr. Ubuguyu with us?
Yes, Bent.
Yes, thank you. Welcome, Dr. Ubuguyu. I would like to welcome you to the session, and the floor is yours.
Okay, thank you very much, Bent. Good morning, good afternoon, good evening, everyone. Yeah, I'll just take you through what is happening in Tanzania at the moment. One, just to highlight on NCD at grants. Just see the prevalence of NCD in Tanzania. In every 10 attendance to the hospital, just one is attributed to non-communicable diseases. Unfortunately, when you look at the mortality, 1 out of 3 deaths is attributed by non-communicable diseases. Mind you that the remaining 67% is due to communicable disease. So the two conditions are overlapping, and it is quite alarming at the moment. Again, when you see on how much are we spending on our health budget, it's a relative little. It is around 10 to 15% of our budget goes to the healthcare settings, and this is what is direct and indirect costs on healthcare investments. Unfortunately, again, only 15% of Tanzanians who was registered on health insurance schemes, making out 85% of Tanzanians paying out of their pockets for healthcare services, and make them very vulnerable. Again, when we did some of studies and some of the clinical findings, what we have observed is many people can't afford to pay for the NCD services, and unfortunately, people succumb very early. Many people with NCDs dies before age of 60, and many because they can't afford to pay for health services. At the moment, what we are paying for the dialysis, for example, is almost 400 USD per week, which is quite high even for the higher government officials. We can't afford to pay for such amount. So we've seen a lot of people selling their assets only to find out that after 1 year they can't afford to continue with the treatment, and end up dying very, very poor. During the COVID pandemic, and before that, when we did our STEP survey, what we observed is almost 3/4 of people who are diagnosed with NCDs, be it cardiovascular conditions, diabetes, cancer, etc., they are not aware that they have all those conditions until when they present with symptoms, and in most cases it is become very late. looking at what happened during COVID, where a number of people, some young, succumbed from the conditions because they were not aware that there were other comorbid conditions, and only to find out that they have NCD when they have COVID and probably they are at ICU. So in Tanzania, what are we doing at the moment? We think of doing both primary and secondary interventions concurrently, because we've got quite a good number of people who have NCD and they're not aware. So we are doing screening at the moment. We are going to the community, treating especially on the primary healthcare level, just screening and treating. At the same time, what we also scale up our NCD prevention campaigns. But as a government, we are passing the bills so that all Tanzanians to have a mandatory health insurance scheme, probably we will minimize number of the people who are paying for the service. And with the health insurance scheme, what we want to do is just having a pooled resources so that it will be easier for us at least to minimize some of suffering to our clients. But again, our health policy is a little bit welcoming to people, because we have people who get some exemption. When you have a serious condition and you can't afford for it, you just submit some of the evidence saying that you can't afford for the service. But unfortunately, we make our health system vulnerable, because what we have at our health budget is relatively little, and pulling a lot of people with NCDs into treatment scheme without paying for the services become even worse to those who have and those who don't have. So these are some of the few things that we are doing. Again, integration of NCD with other services, notably HIV and tuberculosis, is one of our agenda and the direction to take at the moment. Again, support from donors, community, also add some chunk, especially a quota of our interventions comes from the donor community. And thanks to Bent, WDF, and other philanthropies who are contributing to our NCD interventions at the moment.
Thank you, Dr. Buguyo, for this, I would say, encouraging intervention. I believe you launched a national NCD prevention and control program back in 2019. So I think we can say that that's another proof of progress since our 2018 first dialogue on financing. And I think there's so much material in your intervention and the perspectives from Tanzania that we will touch upon also when we reach the Q&A. It would be interesting also to hear from you, Dr. Buguyo, how the national health resource mobilization has progressed along the lines with the NCD program implementation, and as you said, the linkage to other health sectors. But we will move on to our third and final panelist in this session, and that is Mr. Luis Galicia from Ministry of Health in Uruguay. Luis, the floor is yours. Thank you.
Muchas gracias, Bent, y gracias a la NCD Alliance por la invitación.
Thank you very much, Bent, and thank you to the NCD Alliance for your invitation. In Uruguay, as well as all the other MSS states, we recognize the importance of financing the NCDs for their effective prevention and control. However, we are very concerned about the fact that they are not in a priority in the international or national agendas of cooperation agendas. And this situation was worsened by the COVID-19 pandemic. And additionally, many of the commercial determinants of health were having an impact in the different implementations and actions taken, informed by different entities of civil society. The Public Ministry of Health together with other government sectors, has implemented a series of policies for the prevention and control of the risk factors of the NCDs, including an integral agenda for the tobacco control and actions for the production of healthy food and physical activity, as well as the regulation of food or unhealthy foods. In terms of the care in the framework of the integrated national health system that gives or provides universal coverage to all residents in the country, we established a payment by performance system. And there is a portion of the share that the state pays to all the suppliers for per affiliate that will be reimbursed if the patient complies with our goals. Our goals include indicators of these targets linked to cancer, hypertension, diabetes, and acute myocardial infarction and cerebrovascular infarct indicators. And finally, in the financing mechanisms, Uruguay established more than 40 years ago the National Resource Fund that provides finance coverage to procedures, high complex procedures, devices, and high-priced drugs to all residents in the country as part of this national integrated health coverage. On the other hand, Uruguay has been making efforts to comply with related commitments to reduce taxes on risk mitigation actions and also on the tobacco, but we have an important delay in terms of taxes, alcohol beverages and sugary beverages. We have allocated a part of these taxes to the prevention and control of NCDs, and we're also having an unresolved matter in terms of the alliances with private entities that provide sufficient financing to comply with the SDG 3.4. As part of the actions that are needed for mental health, Uruguay was incorporated as the founder's partner to catalyze actions for the NCDs on mental health, giving a continuity to the Commission recommendations of the WHO and looking for keeping the highest priority on this theme. This fund is destined to responding the demands of low and middle income countries, complying with the United Nations goals, and also counting with private funding, waiting for donors, and private donors as well could contribute their part. This fund can boost the urgent response that is necessary for NCDs through the application of the best investments or the best buys of the WHO, in particular through the application or implementation of health taxes. And this fund could help groups of countries to increase the South-South cooperation and the triangular cooperation that we deem so important in topics that can be tackled together, such as the regulation of transborder publicity of non-healthy products, and in the search of these innovative mechanisms for funding or financing. Uruguay understands that this fund is a very important milestone for the mental health and NCDs problem, and it can also help in the response to NCDs in such urgent cases such as epidemics, for example.
This was actually a brilliant and very broad intervention from your side. You actually responded already to one of the questions I had prepared for you, how Uruguay has, embarked both on a very strong NCD prevention and control process nationally, domestically. I was there in Montevideo at the 2017 high-level meeting, and you could see how progressive a lot of the national policy work and health system progress was done. At the same time, we see Uruguay committed into the multi-partner trust fund that you mentioned, which is another very, very critical mechanism as part of our joint movement ahead, mobilizing resources, especially, of course, also for low and middle income countries. That will allow a few minutes for questions. And I think I would move back to you, Paul. We don't have that much time left, but we had a question from the audience. And I think it would be very pertinent to ask you, given your earlier statements. NCDs, you said, could not be tackled on its own. It had to be part of a wider health system reform under UHC and health insurance schemes. But at the same time, many countries, or all of us, we are also looking at other challenges such as climate change and other challenges that are resource demanding. Could you just give us a few final perspective on how you see that perspective of an even broader global support, because the NCDs are also determinants of other factors that are affecting our lives. Please, Paul, a final remark from you.
Very good. No, I think these are exactly the challenges ahead of us. And to put it quite simplistic, I think we have a lot of experience in basically being able to both identify and deliver high impact effective interventions within the health sector. And we definitely need to do so also when it comes to the fight against NCDs. I mean, it's very clear with a high blood pressure, diabetes. I mean, these are conditions that require curative services, but they also require, since all of these are also, shall we say, affected by risk factors and determinants of health, we need to a larger degree from a health sector perspective to work with other sectors. I think the past decades, including during the pandemic, we have seen that, for instance, working on gender equality, working with the education sector, we've seen the power also of social safety nets that many countries have introduced are really important. And we see a very important push for nutrition. What we do see is that, I mean, there are 7 million deaths, I mean, from air pollution each year, and this will continue to increase. So even, shall we say, redoubling efforts on urban health, and basically working on pollution and other environmental issues that are continuing to increase is something that we need basically to be better on, also from a health sector perspective. This goes across governments, but it's very clear that as health advocates, as ministers of health, we have a stewardship responsibility to find solutions together with sectors. And that also includes not only the traditional sectors, but also the private sector. So working in partnership with companies, with private sector will be key as we move forward.
Thank you so much, Paul. And the final remark on this panel will be from you, Dr. Buguyu. I tried to hint it before. We saw the launch of the National NCD Prevention and Control in Tanzania in 2019. We are now in 2022. How do you envision the coming years up until 2030 for the Tanzanian NCD response as part of the UHC movement and the domestic resources that you will see, hopefully, into a balanced health system reform? A final remark, Dr. Buguyu, please.
Okay, thank you, Bent. Yeah, when we launched the NCD program, National NCD programs in 2019, our idea is in Tanzania, like in many other countries, we have little resources to be shared among ourselves. Unfortunately, when we were tackling NCDs, professionals or experts were most of the time focusing on a single condition. You get a pool of expertise on cancer, you have a pool of expertise on diabetes, you have a pool of psychiatrists and so many team members. And all of these, we are diverting resources to disease specific. So when we establish the NCD programs, we want to pool all the resources that we have. And actually we dedicated the second week of November as a National NCD week, so that all the expertise come together, leveraging resources, and have a common agenda on fighting NCDs on that week, demonstrating all the major preventive interventions that include physical activities, nutrition, health education, talking in the same language, having the same platform, sharing research's findings and innovations helps us to leverage on the rich resources that we have. So in the next 8 years, in the coming 8 years, what we see is one, to have more people joining in the group. Two, scaling up NCD intervention to the community, because most of our people are not aware of the NCD. If we join forces, we go to the community, giving them understanding on NCD risk factors, early detections and treatment. Again, collaborating with other sectors to fight NCDs, because health sectors alone will not be sufficient to combat the disease. And at the moment, we managed to move in the Parliament and Prime Minister's office to be on board. So things are very promising, and probably in 2030 will be better than what we have today.
I really like that comment at the end, Dr. Buguye. Things are promising, because I think we need to bring articulation of progress that we can build on. The results that are actually there should be disseminated and inspire all of us. This was the conclusion of the first panel. I believe it was a very strong and insightful statements. Thank you very much, Paul, Dr. Buguye, and Luis, and I wish you all the best, and we will move on with the next part of the event, which will be short video testimonies from civil society and national level stakeholders from 3 countries, Ghana, Mexico, and India. And we will start with a statement from Mr. Joshua Mkubu, who is the Minister of the Oti region in Ghana, but he's also part of the Ghana Society of the Physically Disabled, and of course the Ghana NCD Alliance. Could we have the video statement on, please?
Joshua Makubu is my name, the Minister for Oti region in Ghana, West Africa. From a personal experience, and as an advocate, I can say without any equivocation that the treatment for non-communicable diseases such as hypertension, diabetes, kidney-related issues, and other cardiovascular diseases is very exorbitant in Ghana. Unfortunately, governments all over the world have not made adequate budgetary allocation for the treatment and care for non-communicable diseases. This is more than a pandemic. NCD is a pandemic that is even worse than the COVID-19. I therefore call on government all over the world to ensure that NCD's treatment and care is factored adequately into their health budgets.
I think it was very important to have the voice here from the representative of Ghana. We have seen in Ghana great progress in terms of civil society mobilization and engagement, the Ghana NCD Alliance, of course. We also saw earlier this year the Ghana hosting the International Strategic Dialogue and linkage to the global WHO Global Diabetes Compact. So obviously very important to see that resources from communities and actually people affected by or living with NCDs are so key to the sustainable NCD response at national level, where the responses must be anchored. The same is actually of equal importance and relevance to our next video statement from Mr. Jaime Barba, who is, in our views, our Voices advocate. I suppose those of you who have followed that campaign, but he is also with the Mexico Saludable Coalition, and I think we should have the video on of Mr. Barber, please?
There are governments that pretend to save on health. Well, it's in English, sorry.
Muchas personas que vivimos con una enfermedad no transmisible murieron por COVID. Otros por
Well, I'm going to read it anyway. Many more died due to lack of medicine. I'm Jaime Barba, Mexican ex-smoker. I live with COPD. I'm a COVID survivor. We say enough to decision makers. Health comes first. Let's make better public policies for prevention. Let's raise taxes for tobacco and have more investment in healthcare and accountability. Let's prevent suffering and catastrophic health spending. Let's work together, government, society, and us as part of the solution. Let's invest in universal healthcare now, quality universal healthcare now.
Thank you to Mr. Barber for this powerful statement. And again, we know Mexico is one of the countries with a high NCD burden from diabetes, from obesity, and also other of the risk factors. And again, resource mobilization through national alliances, coalitions, broader involvement of sectors is the only sustainable way forward for a long-term NCD response in any place in the world. And that's also why I think it's important that we go to the third video statement, this time from India, Dr. Pramesh, who is the director of the Tata Memorial Hospital. Could we have the video statement on, please?
I'm Dr. Pramesh, and I'm the director of the Tata Memorial Hospital in Mumbai and the convener of the National Cancer Grid, a large network of over 270 cancer centers, research institutes, and patient groups created by the Indian government to work towards improving access to affordable cancer care across the country. Public healthcare investment in many low and middle income countries are inadequate and need to be increased substantially. This lack of affordable publicly funded healthcare results in considerable out-of-pocket spending and catastrophic healthcare expenditure among patients. The double burden of infectious disease and NCDs are a major cause of morbidity and mortality in LMICs, and hence efficient public health systems need to be embedded in universal healthcare efforts. Schemes like the ABPMJ or the Ayushman Bharat scheme in India that include free healthcare, including treatment for NCDs, to over 500 million people are important steps towards achieving the goal of universal healthcare.
Thank you to Dr. Pramesh for this also very important intervention. I think here we heard about new coverage schemes, going back to the health insurance discussion we had in the earlier panel, the Ayushman Bharat initiative, maybe a very important, certainly a very important initiative to be following over the coming years. I should also mention that in Mexico, we've seen great progress, for instance, on food labeling on the preventive and legislative side. This is now time for our third and final panel, which will bring into our event speaker from international agencies. And we will start with Rachel Nugent, who is the Vice President for Global NCDs with RTI International. And certainly, Rachel, you were there in 2018 here in Denmark, Copenhagen, for the first global dialogue on NCDs and finance. So I have been looking forward to your intervention today to learn from you how you've seen the progress since then, or the lack of progress. I'll pass on the word to you, and hopefully you will bring even more insights that we can move on with. Thank you, Rachel.
Thank you, Bent. It's so nice to see you and to see the names of many friends and companions in this effort to support people living with NCDs around the world. So let me address where we were then and where we are now in regard to NCDs and economics. Why do we look at NCDs in conjunction with economics? Well, the purpose at the time, and still so important, first is to communicate with the people in finance, particularly in countries, giving the people in the health ministries and the advocates the ability to speak to people who have so much power, the people who are in finance. Second, to help make better decisions, to help choose the right ways to provide better health, to prevent disease and so on, to spend money well. And third, to understand the economic impacts of NCDs and their risks on households and on countries. So organized by the Lancet, Richard Beaglehole and myself at the time, we produced the Lancet Task Force on NCDs and Economics. We developed it over several years with really a stellar group of economists and policy experts. And it was published for the 2018 Copenhagen and WHO supported financing dialogue. So it was a very exciting time to sort of bring together a lot of what was known and to point to what was as yet unknown. So where were we then in regard to NCDs and economics? Well, we were trying to convincingly answer the question, why should funders add NCDs to their agendas? Why? So we had papers on NCDs and the SDGs, of course, SDG 3.4. When we were probably more optimistic then than now. We'll come back to that. We had a good paper on household impacts and especially the connection to poverty, where we were able to provide irrefutable evidence of the link between NCDs and impoverishment. We had a very strong paper on fiscal policies, particularly price policies and equity, where we wanted to address the charge that raising taxes on harmful commodities would be regressive. And we did very convincingly provide important evidence that it is not necessarily regressive. And we wanted to provide the investment case for NCDs. That was led by WHO colleagues. It was a rather narrow investment case with only 3 interventions and looking at data from 20 countries, and we have progressed much since then. So that's what the Lancet Task Force was. I'll show you. If you can see it. Sorry for the, I guess the screen doesn't allow it to be seen very clearly. I think I still have a couple boxes of those in case anyone needs it. The Lancet was very generous. So let me just go to where are we now? We have convincingly and thoroughly answered the question, the why question, and we have made substantial progress on the how question. In what ways? On NCDs and SDGs, well, we know from the countdown and from other evidence that has been published that we are way behind in many, many countries. We understand why we're behind too, and I think that's very important. So that's not such a positive situation right now, but obviously we know what we need to do. On household impacts and poverty, we have a much better understanding, especially on the behavioral economics aspects. What can we do to change people's behavior? Also, and very importantly, it's not just about individual behavior. Okay, the household impacts and poverty are about these out-of-pocket payments, about the lack of financial protection and so on that has been mentioned earlier. So we understand much better the links and how to change that. On fiscal policies for health, well, I'm delighted to say that just a few weeks ago, an entire book was published on health taxes policy and practice, for those of you who want to find it, prepared by Imperial College and WHO. An entire book with evidence about what works, how it works, who is affected, a lot of detail from experience. That's, you know, a whole book when a few years back we had only one article, right? That's incredible progress. And many taxes and fiscal policy mechanisms have been put in place in countries since those days. And finally, on the investment cases, more than 100 investment cases have been published on NCDs and their risk factors in countries, not just the global case. That's important, yes, but to me, it is more important to have the country level investment cases. And not only do we have NCD investment cases covering a range of conditions and risk factors, we have more detailed investment cases on mental health, on tobacco, on obesity, on cancer, on specific NCDs. Now, why is that important? It's important because that's what helps guide countries on how to do things better. A quick example, and I know that we are just about out of time.
Yeah,
we
quick one, Rachel. Yeah.
In Kenya, we moved from an NCD investment case to a cancer-specific investment case to help the government think about how to improve their cancer care delivery, and they are moving on that. So we have better knowledge on a lot of these issues, and we have a ways to go. But I think it's a positive situation, Ben. Thank you.
Yes, and I really like that, because I had as a personal ambition of this event today that we could at least bring some positive statements or lessons out there to the global audience, so that you can actually articulate that progress is possible. And thank you, Rachel, for that. We will get back to you, of course, in the Q&A. There's so much there, and thank you again. Wonderful to see you also. We will move on to our second panelist in this final session, who is Dr. Kelly Henning, Public Health Program Lead of Bloomberg Philanthropies. Do we have Kelly with us? Yes, we do. Welcome, Kelly, to the panel. Obviously, we know for many years about the commitment of Bloomberg Philanthropies into the NCD response globally. So please, could we get your intervention? Thank you.
Thank you so much, Bent. It's really a pleasure to be here, and thanks to the NCD Alliance for including Bloomberg Philanthropies in the discussion. First, I'd like to take a moment to reflect on some of the lessons we've learned at Bloomberg Philanthropies through our NCD work, which is in fact the major focus of all of our investments in public health and has been for the last 16 years. I think our first takeaway and principle here is that investment in prevention really works. The recent WHO report, Saving Lives, Spending Less, showcases the cost effectiveness of strategies to prevent NCDs. And that report very clearly shows that for every dollar invested in NCD prevention and care, such as reducing tobacco and alcohol, reducing unhealthy diets, improving physical activity, cancer screening, managing cardiovascular disease and diabetes, we will see at least a $7 return by 2030, which is not really that far off. That return is in terms of increased productivity, increased employment, and longer lives. This fact has been very convincing for Bloomberg Philanthropies in terms of our ongoing engagement in this space. We also focus on policies that aim to reduce NCD risk factors, such as increasing health taxes, which have been referred to a number of times in this session, restrictions on marketing and sales of harmful products, things like trans fats and tobacco, as well as dissemination of information and education. A second takeaway for us working on NCD prevention and control is affordable. An additional investment of 84 cents per person per year in lower income countries could deliver a package of measures that will reduce the burden of NCDs, and these types of investments would move us significantly closer to achieving SDG 3.4. Our third takeaway is that although government can and does take action on NCD prevention effectively, there are powerful stakeholders promoting and selling harmful products. It takes resolve at the highest levels of leadership to push back against these interests and requires effective public education so that the population can support and participate in the change that's needed. And our fourth takeaway really has been that this work requires a team effort. National governments, intergovernmental agencies like WHO and others, researchers, civil society for certain, these are all critical participants in putting effective policies in place and enforcing them so that they are effective. In his video, Mike Bloomberg highlighted one piece of our work that I'd like to build on. As he noted, in 2018, we convened the Task Force on Fiscal Policy for Health, a group of world leaders in health and in finance. And the task force concluded that raising health taxes, those on tobacco, alcohol, and sweetened beverages, is highly underutilized and would save millions of lives and bring in much needed government revenue. The impacts can be enormous. After reviewing the evidence, the task force found that tobacco taxes can do more to reduce premature mortality than any other single health policy. And unfortunately, since the task force report came out, we haven't really made all that much progress. And why is that? The task force concluded that implementing health taxes was a measure of government resolve because industries push back against tax increases with false and misleading statements and often have significant influence on government decisions. Unfortunately, these misinformation campaigns have continued even as we move through the current health and economic crisis caused by the pandemic. In the context of the COVID pandemic, implementing effective health taxes has only become more critical. The use of alcohol and tobacco and obesity and diabetes are all key risk factors for worse outcomes. In addition, the pandemic has decimated public health and health delivery systems, and they need to be rebuilt and strengthened. So it's hard to find a more fitting moment to respond to these challenges, and the use of health taxes is so important. As Larry Summers, the co-chair of the task force, said, we should tax the things that are killing us. Health taxes represent low-hanging fruit that can significantly improve health and save lives. I'll conclude there. Thank you very much.
Thank you very much, Kelly. I believe this was a short glimpse, but a very powerful intervention about all the different streams of work that you engage in. I also tried today to highlight those special elements of progress since 2018. And definitely you mentioned many of them here. I also noted earlier this year your renewed commitment to the Resolve to Save Lives initiative. I think this is really critical. I guess we have more than 1 billion people with hypertension worldwide as we speak. But we will come back to you. There are so many things to elaborate on, time allowing, but we will move on to our third panelist in this final session. It's Vuyiseka Dubula-Majola from the Africa Center for HIV/AIDS Management in South Africa. So Dr. Vuyiseka, welcome to this event. We're grateful for your presence, and please share with us your intervention. Thank you.
Thank you so much, Brent, for the invitation. I think 4 minutes, I won't do justice in sharing the lessons from the HIV financing and the HIV movement, but I'm going to share some highlights and maybe some take-home messages in terms of what are some of the shifts and opportunities that are there that maybe we could try and integrate some of the messaging from the NCD Alliance campaign and movements. So mine is just to share that one of the things that we as the HIV movement, I live with HIV openly and I've been part of the HIV movement for 20 years, and I've lived through some of these shifts, and some of them are frustrating because we've moved on from some of, siloed thinking about HIV financing, yet the donors sometimes are resisting to shift because it's easy to finance one disease over the other because you can either, measure this easy, and to go to NCDs for some of the donors, the thinking is that we're going to investing in the health system. How are we going to measure? How are we going to hold countries accountable? Which we know that in reality, we're talking about the same patient, especially with the aging population of the HIV population. We definitely are sometimes talking about the same patient who lives with multiple conditions, and you can't select one condition to treat and leave the other on the side. So in '96, as an example, HIV almost didn't feature in HIV programming in many countries. For example, globally, we spent about 300 million per year on HIV because there wasn't treatment at the time. There wasn't much to go on. Basically, people with HIV like myself were left to die at home with no response from any government. And it took activists and people living with HIV to galvanize society to say, look, we can't die in silence, and we need to fight to make sure that HIV is on the agenda and it's also financed. We also, at the same time, while we were fighting for increased budgets, we also acknowledged that the treatment for HIV was hugely expensive. And our investment was to also put pressure on multinational companies, particularly pharmaceutical companies, to reduce the prices. It was a long, difficult war, which is still continuing as we have seen with COVID. But with HIV treatment, the prices significantly dropped after several years of putting pressure to drug companies. That then allowed governments to at least say, we can now afford antiretroviral treatment. Of course, I can't say the same about my country. Even when the drugs were cheaper, My country didn't, take that opportunity. We had to force it to change the policy. But the activist pressure also attracted a lot of media coverage. So then HIV became one of the sexy things to fund. And if you were not funding HIV, it was like, what's wrong with you? So because of that, we kind of, in a way, made HIV an exception, and we exceptionalized HIV. Obviously, TB was left on the side, malaria, not so much, and many other conditions, not so much. It's something we acknowledge today as AIDS activists. Over and above pushing through the price reduction and pushing our governments to increase the HIV budgets, we also lobbied our governments at a UN level to ensure that there's a commitment at the UN General Special Assembly in 2001 that there has to be a commitment and a target in terms of how much should be allocated and how much should be at least be available for HIV treatment in many countries. And we also pushed our African countries to have an Abuja declaration of 15% of their national budgets dedicated to healthcare systems. Of course, that's still not yet, we're not yet there. We're still at 6% in many countries in terms of health expenditure to HIV. Also, we pushed for the Global Fund, which we know that the Global Fund is what I call a people's fund. We called for a people's fund that is, in my view, it's people with HIV who are at the center of deciding there. Of course, we don't give the money because we don't have the money, but we're allowed to put forward our needs. PEPFAR, the same. As much as PEPFAR's, the US contribution is not purely a people's fund, but at least there is an opportunity for people living with HIV to influence country operational plans through what we call the COPs. We also offer a people's COPs. So when PEPFAR comes to countries, we also say, here are our needs, and here is the people's COP, and here are our priorities. You better integrate our priorities in your country operational plans when you come to our countries. Of course, as I said, 4 minutes is not going to be enough. I'm really rushing through this.
No, it's
there
okay.
are opportunities.
Yes.
Honestly, there are opportunities in HIV to integrate much more than we are integrating. We've moved from HIV being a death sentence. Now HIV is a chronic disease. What is stopping us from approaching chronic care rather than just HIV care and use the HIV budget to also spread it across to benefit other chronic diseases?
I'll cut you there, Dr. Wieseka. Apologies, but time is running. This was a very powerful statement. I especially was waiting for some of those final reflections about the integrated health services. We have been having that question for a while about the Global Fund on HIV and TB. Evidence is there arguing the case that patients with these conditions are very vulnerable to NCDs such as diabetes, hypertension, and others. I believe we are very far in that process. I would also like to learn from you what happened there in Montreal earlier this year. I think there was some very rich discussions about these things, but that might be for the final Q&A. But before that, we will move to our final speaker today in this panel. And I think we've been through a lot of the sectors that I mentioned in the beginning, domestic resource, government resourcing, civil society resourcing, and also multi and bilateral resourcing. But at this moment, I think it's also very interesting to learn more about the modalities and engagements with private sector financing area, and which is in itself a very complex matter. But to help us get more insights, and before I give you the word, Charles, it's probably also an area which has a lot of potential that has not been unleashed, or you can say explored sufficiently yet, not only for NCDs, but for other areas. Here we have with us today Charles Dalton, who is Senior Health Specialist with the International Finance Corporation. Charles, thank you so much for joining us, and the floor is yours.
Thank you very much, and thank you for the opportunity to participate in this in the event today. So my role at IFC has exposed me to many different global healthcare systems, and it's confirmed what we've been hearing today, that the demand to supply challenging facing countries for NCDs is very negatively skewed, and that we have infrastructure financing, human resources, and just services not able from neither a public or private perspective to get to that demand supply gap. As the private sector focus of the World Bank, the IFC, we invest in private health services, life sciences, pharma and vaccines, medical equipment, and also digital health. So our investments are focused on strengthening healthcare systems. We believe that governments are the custodians of the entire health system, and that each country, based on its own specific profile, when appropriate, can utilize the private sector, and we believe the private sector has a significant role to play when used correctly for NCDs. We also acknowledge that many governments do not have the financial resources to significantly expand their NCD services, and that we're also concerned that many governments don't have the necessary data analytic capabilities to understand the demand gaps and how to plan service provision effectively. And one thing we are noting that we're noting that governments aren't necessarily collecting data from the private sector to really understand that NCD burden better. We also note in this conversation today that there's been a huge uptake in conversation recently with traditional development partners, philanthropic entities wanting to understand and take a deeper look at NCDs. And we believe that now is the right moment for increased public and private collaboration. And I want to emphasize the word collaboration. So many of our investments now do touch on NCDs. So many of the entities we look at are providing NCD care. So for example, we've made an investment in Mexico in a group called Clínicas del Azucar. It's a growing clinic group with an innovative basic model that helps patients better manage their diabetes and hypertension so they don't get the complexities where they end up in hospitals. We're also working with partners to start to look at better innovative private sector models that can support governments in addressing the NCD gap. So probably the most obvious example for me at the moment is our work with the City Cancer Challenge. We've signed an agreement with them, and we're looking at identifying up to 4 pilot cities in low and middle income countries to implement scalable cancer care projects. So in the first stage of this work, we're going to develop and co-fund with them market and pre-feasibility studies for cancer care interventions in a variety of these cities. And the partnership will seek to identify ways to bring local government together with private sector investment required because of the capital intensive nature and technology advancement of some cancer care services. We're also pushing ourselves to look at innovative finance as well. So unfortunately, for many private sector entities, access to finance remains a challenge in many of the markets that we look at, because funders don't necessarily understand how to work with the private sector. So some quick examples. The Africa Medical Equipment Fund. So we're working with OEMs and local banks, and we've established a funding mechanism to provide lease financing for medical equipment. And we work with the banks to help them evaluate healthcare businesses. We work with the HMSEs to help them prepare bankable loan applications for the right equipment, many of which is being used for NCDs. In Brazil, we're funding Santander with an initiative to provide small health entities with loans to expand their businesses, again, touching on NCDs. We're currently working with the Uzbekistan government for a network of radiotherapy centers in 3 regions of the country. And this is an innovative approach because it's looking at the infrastructure and the delivery of services. And again, in Uzbekistan, through a PPP process, we advised the government on how to establish a PPP for dialysis, which has significantly brought the price of dialysis, but expanded the access. And they're now working with an Indian entity called Nephro Plus. So finally, I just want to emphasize that the importance to get NCD management right. UHC is fundamental. UHC is a key building block for more robust public-private collaboration. A weak national UHC is a direct threat to managing NCDs and potentially a lost opportunity to effectively integrate private healthcare with public to get through all the volume of demand that's required. So thank you very much.
Thank you so much, Charles. This was brilliant. And again, throughout the past hour and a bit more, we have had now some statements with a very, I would say, encouraging perspective of hope that there are modalities, mechanisms already in place which actually mobilize resources in very different formats. I think this was really encouraging, Charles. We are now entering the last 14 minutes of today's event. So I will very soon go to our final speaker, who is Dr. Bente Mikkelsen, Director of NCDs at the WHO, and of course discuss with her, giving her the possibility to summarize the event and looking ahead for the second global dialogue on NCDs and financing. To give you four panelists, Rachel, Kelly, Vuyiseka, and Charles, a final minute, and please keep it at 1 minute. Could you say to us which are your hopes and expectations for next year's NCD, second Global NCD and Financing Conference? Rachel, we'll start with you. Please let us know what your aspirations are or your encouragements. Thank you.
Sure, thank you, Bent. My aspirations would be that there would be at least 3 significant donor organizations and 3 countries that would come to the table and say, here's exactly what we're doing and what we're spending, because I think the transparency about what is being spent and where the money is going is incredibly important. So let's get that those examples out there as examples to others to show what they can do and the importance of the impact that is achieved when there is thoughtfulness around it. And I think NORAD, of course, can take the lead in guidance to others about what is working for them and what they had to do to get to where they are now in supporting countries. Over. Thank you.
Wonderful, Kelly. Sorry, Rachel. And now we will like to give you a minute or so, Kelly, let's hear from you. Bloomberg Philanthropies, such a critical stakeholder in the NCD response globally. How would you foresee, or what are your expectations to the next year's second global dialogue? Please, Kelly.
Ben, thank you. I mean, I think Bloomberg Philanthropies really welcomes the opportunity to work with other donors. We have been a little bit alone out there in terms of being able to raise interest from other philanthropic organizations. We think of our work as somewhat catalytic. We fully recognize that this really sits in the realm of government and multilaterals, but we do think that the philanthropic space can be quite catalytic and create some models that can be useful to countries. So I guess for me, it's more about increasing interest and bringing others on board.
This was really at least one thing I had hoped we could discuss today, the partnership, the coalition, the co-investment frameworks. I can only say from World Diabetes Foundation side, we are trying to find the same, and I'm sure we are more in that boat, and we should sail on more jointly. But Vuyiseka, please, 1 minute of time for you to give your aspirations for next year's second global dialogue on financing, please.
One is I would like to invite the HIV movement, TB movement, cancer movements to come together. We have to start from building that power amongst ourselves who live with these conditions and push from below. Second is we need to, at the very least, for those who are living in my continent, to push for the African Union to at least have a target on NCD spending. We've tried that for HIV. What's stopping us from doing that for NCDs? Until we get UHC, we have to go and move incrementally until we get there. The third one, once they commit, we have to track and expose how much they are spending in each country and expose them. They expose it's a very, I'm putting it very mildly, it's a track and shame. Basically shame the countries that are not spending. Because by them not being shamed, there's no incentive for them to increase their spending. Therefore, we are allowing people to die in our watch, people like me and you.
Thank you, Vuyiseka. I think you mentioned the African Union. There was recently a new NCD strategy launched by the African CDC, which I think hopefully could also help us advance the response on the African continent. Finally, Charles, a final minute for you. Your expectations or your visions for next year's second global dialogue on financing, please.
Yeah, I think I'll just keep this very short. I mean, for me, it's commitment, but confirmed initiatives. We can talk, but we need confirmed initiatives to sort of drive the collaboration for change. And that's, I'm coming from the perspective of bringing development partners together, governments together, and the private sector as well. And one other area for me, and this is maybe more of a personal thing, is we need to help governments understand the data analytics. We need to help them better manage their disease risk and understand the risk in the populations. That will then also help them, inform them on how to do better purchasing models, which they can use for public sector and for the private sector. Thank you.
Thank you so much, all of you, for your contributions to this panel. We are now 10 minutes from ending the session, and I think this has been as rewarding and inspiring as I had hoped. But I will leave it now to WHO Director of NCD's, WHO NCD UAT Department Director, Dr. Bente Mikkelsen, to give us a summary or reflection of what we've heard. And also, of course, the vision for the second global dialogue on NCDs and funding next year. Bente, we were there in 2018 in Denmark for the first global dialogue. I think that time we took a big step. Now we are 4 years down the line, and okay, we can still see that a lot of investment is needed. I think we have improved our thinking, and we know more than we did. We have heard today so much progress is actually there on the ground. But how can we accelerate it at the pace we need? Please, Bente, the floor is yours.
Thank you very much, Bent. And first of all, we need all of you that has spoken today and more. And I think thank you to NCD Alliance bringing all these voices together. I just want to make some reflections first, because it is for me a huge disappointment that many countries doesn't really realize the epidemiological shift that has happened from HIV, malaria, TB, and of course a need to focus still on maternal and child health, to actually looking at that 7 out of 10 deaths in the world is now linked to NCD, and some of them are even increasing, like diabetes. And all of this is both about risk factors and management, and also about poverty. And as many has mentioned today, out-of-pocket spending is still more the rule than the opposite. Also the case that only 14 countries so far actually are en route to be able to reduce the premature mortality is a very sad fact. You were looking for some good news, Bent, and I will make them before I go into the reflections of the second financing dialogue. Thank you very much to Ghana. Thank you very much to Norway. And thank you also to Dr. Tedros, my own boss, because we have been able to have an international strategic dialogue in Ghana that actually launched an NCD Global Compact. And this is so important on the road to 2025. And as some of you know, we will have, as a result, the first gathering of the highest level heads of states in New York during UNGA, hosted by Ambassador Bloomberg. Why is this important? We have had 3 high-level meetings already, a lot of commitments. I think the importance is to really build the ownership and make this under a skin kind of experience for all the countries, because now there is no more time left. We need to move to action and accelerate at the national level. I think the good news, in addition to this very high level engagement, is also that the World Health Assembly had the biggest ever set of resolutions this year in 2022 on NCDs. So our member states realize, and they have called for an implementation roadmap. They have called for a new menu of policy options. And I think we need to discuss this much more, because this is really about what is the threshold for countries to see things as affordable and accessible in their own countries. We will come back to that. I think the third thing we need to take into consideration, and it's not good news, but it is a good opportunity. And I think this is also the answer why so many member states, I was just listening to the regional committee in Afro, really speak so intensively now on the need to do something on NCD. And that is actually the result of COVID. We saw that people with diabetes, cardiovascular diseases, cancer, and chronic respiratory diseases were the people dying more from COVID. So I think we also can agree there cannot be any preparedness or response without investing in NCD. So the good news is we have tools, we have the best buys and other menu of policy options, we have UHC compendium, we have data, but what we totally lack is the demand creation. After trying almost like an NGO to influence on the Global Fund's new strategy, and we made a little bit of progress, it was a clear answer, both from the Global Fund and also on the World Bank early days, I would say early days, because we have improved a lot during the last months, that there is no demand to be seen. When the proposal comes from the country, it doesn't include NCD, and how can that be? So we are even before the data, we are about the demand creation. So I think when we meet again on the NCD and financing, we will have to demonstrate, as Rachel said, more donors, but please be mindful that we have already several countries stepping up. Norway have been mentioned. Denmark has already for 3 years given us money for really the integration of NCD into health systems. We have Germany, we have the European Commission now investing in health workforce at the country level to support us in strengthening the health system, including for NCD. And we have Canada really focusing on primary healthcare. So there is really light in the tunnel. We have private sector dialogues, and I must say, I'm extremely positive and very, very happy that we now can see that private sector is investing together with us, committing together with us to give access to insulin, to diabetes health commodities, and we see the same thing now happening for cardiovascular disease and hypertension treatment. And we also see new philanthropies coming along. We will, I think, in the next coming months, see that there is new investment coming around. I believe we are not there yet. And I really love the HIV suggestion that we need a target. I think we need a target for investment for NCD, and we need a target for also including NCD into UHC, and to, as part of that, really have a measure for the domestic funding, which can very, very well be also linked to the health taxation. We need to meet again. Maybe there will be in Copenhagen, we don't know yet, but we need to meet again. We need to discuss more granular for NCD, for strengthening our health systems, but we also need to look into each and one of the diseases without being afraid that this will be a new fragmentation. Because I think all of us know, even if you go through a lens of cancer or diabetes or hypertension, chronic respiratory diseases, we have to discuss air pollution, environment, tobacco, obesity, healthy diet and physical activity. So we cannot, wherever we start in this agenda, avoid talking about integration both between prevention and control, but also into the health systems. So let's do that, and let's continue, and thank you for really good moderation. And I believe we are a step ahead now from 2018, but unfortunately we are quite far away from where we want to be. And I believe it's possible, and I hope it's possible. And I think by having the voices of the people living with NCD, that will really help us. So thank you also for those voices in this meeting. Thanks a lot, and back to you, Bent.
Thank you, Bente. I believe this was an encouraging summary, but also an encouraging vision, but also a call for action, I would say, for all of us to move forward. Yes, we have learned something today. We put another small piece on our thinking which was a great achievement in itself. I thank you also, Bente, for your leadership on the NCD agenda as we move forward. Now, the session is actually ending. On behalf of the World Diabetes Foundation, I thank the co-hosts, NCD Alliance and the World Health Organization. I hope all of you who have attended have had a productive 90 minutes. It's been a pleasure, and I wish you all the best. Thank you.